Assalamu alaikum warahmatullahi wabarakatuh. Today we will speak about history taking. History is a very important issue in our clinical experience. If you take a good history, you can reach the diagnosis very easily. So the history is very important. This topic discuss about history taking, not history taking. We say building a history, not take a history. Building a history mean that you and your patient are in relationship, so you should participate, you and your patient, to reach the how to solve the problem, clinical problem. So in history we say building a history better than say taking a history. What's meant by history? History is the patient account of their illness. What's his idea, what's his data about his illness, and the data I will ask him and will obtain it from the patient about its clinical problem. History, like all things in the medicine, have a standard sequence, and you should follow this standard sequence to reach the final diagnosis. Before we speaking about how to take a history, we should know some communication skills in dealing with the patient. First, I should knock before entering the room. Okay, the patient, I will address him formally, like Mr. Muhammad, Miss Hanan, Mrs. Wafa, and so on. You should stay comfort, you and your patient. You should have a comfort in your work. Okay, you should have a good eye contact with the patient. Okay, you should speak to the patient by simple language. Okay, very important thing, I don't take the previous diagnosis as a holy Quran. Like the patient may say to you, I have fatty liver, I have chronic liver disease. When you search, the patient don't have a chronic liver disease. The patient, I have hypertension. When you measure blood pressure, you see you see it is hypotension, not hypertension. So you should not take the previous diagnosis as a hallmark. Okay, but I should search by myself to reach the diagnosis. Okay, I should look for hidden concerns underlying chief concern. General rules. I don't write in taking the history, I don't write everything beyond the patient. No, but I should hear the story and write the data at the end. Okay, when I finish taking the history, I should have a good idea about the diagnosis, okay, and about the differential diagnosis. Okay, what is the role of examination? Examination is my chance to confirm or to dismiss or to refuse the data taken from the patient. Okay, I should confirm by examination or I should refuse by examination. Collateral histories. In many situations, the patient may be unconscious, have a dysphagia, have a delirium, like I have Alzheimer. I can't take the data from the patient, so I should ask the collateral relatives. Okay, like if the patient come with the relatives, I should ask the relative, close friends to him, the general practitioner have the data about the patient, the pharmacist, or any patient have witnessed the event. Okay, I can take history from any relevant or any person show the event. The standard framework of the history have some items like personal history, presenting complaint, present history, past medical history, drug history, gynecological history, and family history. Personal history have name of the patient, age, sex, occupation, marital state, residence, handiness, and special habits of medical importance. Okay. After I taking this data, I should write it in one sentence. Like, Ayman Mustafa Ibrahim. If I imagine patient having a problem, like Ayman Mustafa Ibrahim, 45 years old, male, he works as a farmer, he is married and have 2 offsprings. From Zagazig, he is right-handed, he is moderate cigarette smoking, with no other special habits of medical importance. Like that, personal history will be written in one sentence. Okay, the presenting complaint is the patient's own words, and the patient have time, the presenting history have time limit. Okay, the patient's chief symptoms, the patient's own words. Okay, and the time should be mentioned. Okay, we prefer that presenting complaint is a single sentence or only one complaint. Okay, if the patient have several complaints, I should list them and expand them later on in the history. Okay, but it's better to give a single complaint. Okay, the single complaint by patient's in words, and the time of instance should be written. Like, if the patient have hemoptysis, I will mention coughing of blood. If the patient have dyspnea, I will mention awareness of heart, awareness of breathing. Okay, if the patient have hematemesis, I will write vomiting of altered blood. Like, our patient, the imaginary patient, if the patient have hematemesis, I will write in the complaint vomiting of altered blood 1 week ago. Vomiting of altered blood 1 week ago. Present history. Okay. The complaint was the patient's own words, but I don't use medical terms. I don't use medical terms in complaint, but in present history I can use medical term. Okay, and the items should be arranged chronologically. Okay, at present history have 3 main items: the presenting complaint, analysis of the presenting complaint, other symptoms related to chief system. Okay, other symptoms related to other systems. Okay, so present history have 3 points: analysis of the presenting complaint, other symptoms related to chief systems, other symptoms related to other systems. Don't forget, you can use medical terms. The items should be arranged chronologically. Don't forget. Okay, if the patient have long-standing symptoms, I will ask why you seek help now. If any change was happen, if any problem new was happen, why you seek medical search now. Okay, for each symptoms I will ask about the onset, the course, and duration. What is the exacerbating factor? What is the relieving factor? The onset, the date it begins, when it begins, and how it begins. Is it start suddenly, acutely, or gradually? The course, if the symptom was constant, intermittent, or remittent. Okay, changed, is it over the time? Is it improve or deteriorate? Duration, how long it lasts? What makes the symptoms better? What makes the symptoms worse? So we first starting analysis of the complaint. Okay, we'll ask about symptoms related to the chief system, and then system inquiry. System inquiry, after analysis, we said the presenting complaint and symptoms related to chief system, I should make a brief screen of other body systems. We'll give an imaginary data, the patient may forget it. Okay, like, if I will ask about the general symptoms, there is a change in the appetite, fever, lethargy, malaise. Cardiorespiratory, I will ask about cough, expectoration, hemoptysis, chest pain, dyspnea, palpitation, lower limb edema. Gastrointestinal symptoms like weight loss, abdominal pain, dysphagia, odynophagia, nausea, vomiting and indigestion. Genitourinary symptoms like urinary frequency, urgency or precipitancy, dysuria, change in urine volume like oliguria or polyuria, nocturia, and hematuria. Neurological symptoms: headache, dizziness, tingling, weakness, tremors, gait, or sphincteric disturbance. Okay, again, presenting history will take about 3 items: analysis of the complaint, asking about symptoms related to the chief system, ask about symptoms related to other system. After finishing it, I will write again in a continuous words like our imaginary patient. The condition started 3 years ago by acute onset of hematemesis. In the complaint, we say vomiting of altered blood, but here you can use medical term acute onset of hematemesis, about 3 cups, followed by fainting. The patient was admitted to the hospital and received blood transfusion and investigated by liver function test, viral markers, and proved to be hepatitis C virus positive. Upper GIT endoscopy was done and diagnosed as bleeding esophageal varices. The patient remains symptoms free. This is the course till 1 week ago, when the patient have re-experienced a new attack of hematemesis, about 1 cup, and admitted to the hospital and received blood transfusion, and the upper GIT endoscopy was done. This is the analysis of the complaint. Okay. No history of abdominal swelling, abdominal distension, upper or lower GI symptoms, hepatobiliary, urogenital symptoms, no constitutional symptoms, no lower limb edema. These are analysis. The symptoms related to chief system, like vomiting is the GIT or hepatobiliary symptom. So in this item, I will ask about the other liver and GIT related symptoms as mentioned in blue colors. After finishing, I will ask about other systems. No something was found, so I say no symptoms of other system affection. Okay, don't forget presenting complaint, analysis, presenting history, analysis of the complaint, symptoms related to the chief system, other systems. Okay, by the end of this, I have a clear idea about the nature of the problem, when it starts, how it starts, what is the course, what is improving, what is the exacerbating factor, what is the medical advice. Okay, so presenting history is the most important item in the history. Okay, past medical history. After finishing the present history, I have past history, past medical history. Past medical history includes past illness, surgical procedure, or trauma. Past illness, surgical procedure, or trauma. Okay, for each condition, I will ask when it was diagnosed, how it is diagnosed, and how it is treated. Okay, when it is diagnosed, how it is diagnosed, and how it is treated. Okay, don't forget to ask about the main diseases like diabetes, hypertension, rheumatic fever, hypercholesterolemia, ischemic heart disease, bronchial asthma, TB, epilepsy, blood transfusion, and anesthesia related problem. Okay. After taking past history, I should ask, don't forget, how it is diagnosed, when it is diagnosed, and how it is treated. Okay. Drug history. You should list all the medication the patient is taking. Okay, including dose, duration, and side effects if present. Okay. I don't forget to ask about the adherence, compliance of the patient if they take the medication regularly or intermittent or irregular. Okay, don't forget to ask about medications the patient consider it not true drugs like inhalers, sleeping pills, oral contraceptives, oral the counter drugs like drugs treating heartburn like non-steroidal anti-inflammatory, and vitamins. These drugs may have side effects and the patient don't consider it as drugs. Allergy and reactions. If the patient have to comment allergy, I should write it Well, because due to its importance, okay, so the drug history have a separate items, okay. Don't forget to discuss the allergy. It is a true allergy or just unpleasant effect because the patient may have medication make to him tachycardia, make to him GIT upsets. So the patient consider it as allergy. No, it is not true allergy, okay. So if the patient have unpleasant side effect or allergic effect, I should differentiate. I will discuss it. If the patient have a true allergy from the drug, this drug should be written clearly in the patient card. Okay. Past medical history. Our imaginary patient, there is past history of bilharziosis since he was 9 years old, manifested by dysentery and terminal hematuria, investigated by urine and stool analysis, treated by medication, no past history of blood transfusion, no past history of common diseases as diabetes, hypertension, rheumatic fever, no past history of operation or trauma. Gynecological history, the menstrual cycle, is it regular? There is amenorrhea, menorrhagia or metrorrhagia, number of pregnancies, number of deliveries, okay? Number of preterms is present, number of full term is present, number of abortion is present, okay, and the method of contraception. Family history, you should ask about hereditary disease run in family members, okay. If there is a common problem like hypertriglyceridemia, thalassemia, and sickle cell anemia, I should write it, okay. If there is any death in first degree relatives, I should write it, okay. Or some members in the family have the same effect, I should write it because we said many diseases run in family like thalassemia, like hypertriglyceridemia, like thyroid disorders, okay, like malignancies, okay. So family history is a very important thing. Again, history, don't forget it is a very important thing, includes personal history, complaint, present history, past medical history, drug history, family history, okay. By finishing the history, I will take marvelous data, imaginary data about the patient, and I will reach the diagnosis very easily if I follow these steps. Thank you.